Welcome to a wonderful episode of Reboot with Dr. Arasi Maran. I'm your host, Dr. Arasi Maran. I'm a board certified interventional cardiologist who's been in practice for more than a decade. This February is the Go Red Heart Health Awareness Month, and I have the perfect candidate to bring awareness about the heart health. This person suffered as a patient, went through the consequences of not enough awareness, by patients, by family members, by medical team, etc., and had a very long, winding journey. So I think it's better to hear about this journey from her words, her mouth, than mine. So without any further ado, let me introduce Ms. Christine Gallagher. I met her in a clinical setting, but eventually our relationship evolved into a friendship with both our kids going to the same math classes and both our kids going to the same scouts and things like that. So it gives me great pleasure to welcome my dear friend, Mrs. Christine Gallagher.
Hello. I still get to call you doctor though, right? You're in the
You
right
can call me.
setting for that.
You can call me whatever you want to, Christine. So, Christine, tell me a little bit about yourself. Actually, start with your childhood till before you met me, maybe.
Oh my goodness. I won't go back that far. How about that? You know, February is a great month for bringing in the awareness of heart health. And like you said, mine was a long journey. For many years, I was in television news, and I lived my last market when I was single. I was in Orlando, Florida. And I was in TV news for many years and decided that I wanted to move on from that. And so I had moved on to pharmaceutical sales on the animal health side. So I was selling to veterinarians, very different lifestyle. You know, TV news, you're doing these very odd hours. You're up either very early in the morning or you're there till, after midnight. So better hours, better pay. People don't know that. Just very different because we were adding travel to it. But again, I was single, I was on my own, had a new path in life. But after about a year in pharmaceutical sales, I started having chest pains. It wasn't when I was exercising, and I was active. I was swimming down in Orlando. They had this great program where you could go to swim training in the evenings, and you were swimming with triathletes, and you didn't have to be a triathlete to be there, but you had a swim coach there, and he was giving you drills, and you were swimming for about an hour and a half at a time, just drilling really hard. I wasn't the fast lane. I was the slow lane, but he said my strokes were really good. So,
Good. Yes, I mean, nevertheless, it's still very intense exercise, is what I'm hearing from you.
It was good, solid exercise. I was also going to the gym and lifting, not hard, but lifting a little, still doing cardio. And whenever I exercised, that was not when I was having chest pains. It was when I had to do my expense reports or my sales reports.
How old were you at that time?
Oh, yeah, good point. So I'm 52 now. This was back when I was in my 30s and I was having chest pains. So first time I walked into an ER and I'm like, I've never had heartburn before. Can you tell me what heartburn is? And they said, all right, what are you feeling? And I'm like, I've got like a tightness in my chest. And they, of course, put me in the back, and I'm, got IVs, and they're hooking me up to EKGs and things like that. And it didn't show anything. And so I got a cardiologist. So I went to a cardiologist, and they did a stress test, and everything was great. And they sort of said, you're fine, nothing's wrong with you. The one thing that I do remember is, who was getting my cholesterol readings? And that was my OB.
You didn't have a primary care provider. Your OBGYN was your primary care provider.
And that happens a lot with women.
Yes.
It really happens a lot with women. And we'll get back to that in a second, because I think that's a really good point that you and I need to talk about. So that one cardiologist said, everything's fine. You know, you're not overweight. You got skinny little legs. You're active. You're fine. It started happening again. Went to a different cardiologist and did the same thing. Put me on a treadmill. I think they did one other test and nothing came up. But what they didn't do is they didn't do a calcium channel scoring test on me.
Yeah, calcium, CT's calcium scoring, yeah.
Didn't do that. I had really good insurance too. I was working for this big Japanese conglomerate and had excellent health insurance. So it wasn't a matter of I was having to choose, what I could pay for. But they never did a calcium channel scoring test, never talked to me about it either, and never put me in the cath lab. So had that second stress test, and then I had met my husband Mike. I got married. Less than a year later.
Before you go there, so you were still having chest pains. Maybe
Still having chest
how
pains.
many times a week or month
It
were you
was
having chest pains?
very inconsistent.
Okay.
Very inconsistent. There was no consistency to it. There wasn't any ties to it. Couldn't figure out any connection to anything.
Okay.
And then it was sort of like a joke, like, tell Christine she has to do expense reports and it'll make her chest hurt,
Retrospective funny, but not funny at all.
Not funny. But again, when I was swimming with the triathletes, never had chest pains. Yes. When I got on a stair stepper, never had chest pains. So that's, you could put me on a stress test and that wasn't going to be
pass it. You will pass every time because you are a young, healthy person. So I will talk about that. Why the tests were wrong. Yeah.
So second stress test, everything's fine. And that's it. I'd met my husband and we were engaged and we got married. And then a year, we celebrated our 1-year anniversary. And about 2 months later, I started having chest pains when we came out of a restaurant. But that time, I had never had chest pains and shortness of breath. And I felt like I couldn't. It was a different kind of chest pain. It was heavier. I couldn't breathe. And it was also like in my upper back too.
Yeah.
So, and now I understand that women present different. Felt like I was having a hot flash. I'm turning up the air conditioning. But like many women, I didn't want to make my husband mad that I hadn't gone to see a cardiologist when I got to South Carolina. So I said, take me home.
Okay. And you're still in your 30s now. It's not like you're super. Yeah.
I'm 38 years old.
Okay.
Fine. 38 years old. Go home. And when I threw up, I knew something was bad. So we went to the hospital. This was a mistake. We went to the nearest hospital.
Okay.
Now we know when you are feeling like you are having a heart attack, you need to go to the heart hospital.
Yes.
So went to the nearest hospital at the time, and they kept me overnight. They still were not showing, and this had happened before when I had gone to emergency room. They are not showing anything on tests that was showing a heart event. So they weren't showing any elevated enzyme levels.
Interesting. Okay.
So we they kept me overnight. They come in the next day. They go, we think you had a heart attack.
Okay. Okay.
Okay. I'm on IV fluids, including nitroglycerin drip.
Okay, okay.
That night, I started having chest pains on the nitro drip, and I started barking at them, saying, "You need to get me out of here. I need to go somewhere else." And they took me to the heart hospital in Columbia. Slowest ambulance ride in my life. I was like, where's the sirens? It's 2 in the morning.
Yeah.
Get me there faster.
Yes.
Um, and I would, man, I was barking at people. But it was the first time that I was standing up for myself.
Yes, yes. And even then, there was no sirens. You were the slowest ambulance ride. They still did not completely believe that you were having a heart attack or that your
No,
life.
the lady in the front had stopped the ambulance to show the lady in the back how to take my blood pressure.
Oh my God. Okay. Okay.
Then when we got to the hospital, they made me sign a digital thing, and the ambulance person says, "Oh, well, I'll let you re-sign that so we can read it." And I slung the pen at her, and I said, "What does it matter? Get me in there." And
Oh my God.
Mike's has made it to the hospital, went to the wrong parking lot, found his way to the door where I'm, because this is how slow they were to get me in there. And he's like, oh, he saw me, he saw me sling that. I'm like, get me in there. Then it was like the little lead fairies came out because they put me straight into the cath lab. And I said the little lead fairies were running around. It was everybody in their lead vests, and they put me in the cath lab, and my doctor comes in, and he's wearing a tweed jacket because he was this very proper gentleman who was raised by a French mother who said that a gentleman wears a jacket. So
Oh wow.
he's wearing
Okay.
his tweed jacket. And I didn't know to ask then, but I don't want to see anything. I could hear them talking. And I'm
Yes.
like, I don't want to know this. But they put me under and came out and told my husband that I had 100% blockage of the Widowmaker. So 100% blockage of the LAD and an 80% blockage of the circumflex north.
Side wall blood vessels. Yeah.
They stented me and saved my life. And that was in Colombia. So they waited to see how I would improve from there. My ejection fraction was about 27%.
For the audience, that's the function of the heart. The normal ejection fraction of the heart is about 55 or above. So 27% is a very severe reduction in the heart function.
So they wanted to see how the heart muscle recovered after that. And they still wanted to bypass me. So that was in June of 2011. And in November, right after my 39th birthday, they double bypassed me.
Oh, wow. Wow. So let's unpack this, what we've heard so far, Christine, because, there are so many things. I think everyone, just not women, but men should also hear from your story thus far. Okay. We haven't even got to part 2 of your story. You're still in part 1 of your story. That, you were having chest pain. And and this is not a situation where you're a woman who did not have access to healthcare and therefore your symptoms were ignored. You had access to healthcare, but even then, they were not hearing you. And one of the things I've repeatedly said in this podcast is if a person who exercises really well, really intensely, complains of chest pain, that person needs more investigation because exercising people have a higher pain threshold. They're not going to complain about small they know to work through their pain, right? So when they complain of pain, you really have to take it very seriously. And as you said, like maybe a cardiac CT scan or even a heart cath uh, should have been offered to you when it did not get better. The calcium score in a young woman might be negative and may not be enough for a young woman. So maybe a cardiac CT scan where they inject dye and look for blockages like through the IV might have been a better test for you because you would pass every stress test every time and twice on Saturdays because you are so good. You're exercising, you're young, and you're able to exercise with all the blockages you had only because you are young, and young people have intense capacity, and young people also don't believe that they could have a heart problem. So you may not even know what it is until it became impossible, till you had like a acute plaque rupture and the LAD was 100% blocked, which became a life-threatening event. And what I'm hearing is even then, it was a slow process of getting you to the cath lab instead of boom, 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 let's get you to the cath lab within 90 minutes of entry into the hospital. So there are so many things. And you're a unicorn, and not in the billion-dollar unicorn way, but it's very, very rare for a less than 40-year-old to have the kind of blockages you had. So while it's rare, it does happen. So it's rare, but we talk about it so much, and it's life altering, life threatening. So I'm so glad you stood up for yourself.
And let's all, the thing that I've also learned since then is when we talk about heart attacks, we usually have this vision of an old man clutching his chest. Let's emphasize that the number one killer of women is heart disease.
Yes.
And what I didn't know at the time that heart disease also includes stroke, that's all under
Yes.
the same umbrella.
Yes.
And so I didn't think I had a heart history in my family, because the thing is my mother died when I was very young. She died when I was 13. And it was not heart related. She struggled with alcoholism. And so I didn't know what her heart history was. My father at the time had not shown any issues with his heart.
Yeah.
What's funny is that on my father's side of the family, our parents didn't start showing issues with their hearts until my generation had issues first.
Interesting.
So,
Okay.
very, very strange that way. But my mother's mother, she died of a stroke. I didn't understand that is heart disease.
Yes.
So,
Yes.
I didn't understand that was all under the same umbrella. So again, I didn't know to fight for myself more vigorously with that knowledge behind me.
But in all honesty, you did all the right things. I mean, the things that is not very well known, even in the cardiology community, is that when someone can exercise really well and they are complaining of chest pain on other times, it still warrants a very deep, a little bit extra than what you would normally do. For every other person, a stress test would be fantastic, and maybe an echo or an ultrasound all that would have been great. But you're an exercising person who's complaining of chest pain. So your actual stress, when your body was so well adjusted to exercise, it did not perceive exercising as a stress. But when you were getting emotionally stressed out with your expense reports or etc., that was perceived as stress, and that's when your heart was giving you chest pains. It's the same phenomena, but two different sides of the same coin. So it's very nuanced, right? But it's still there.
And what
Stress
they
is a
kept on
cause.
telling me was, "Oh, you don't have heart problems; you have anxiety."
Yeah. Oh my God. Isn't that absolutely an I like, heart disease kills more women than all
All
cancers
cancers
combined.
combined.
Yes. So, but we don't talk about heart disease, and even providers, when they say female patients, the heart disease doesn't pop in their head. It's unfortunate, and that's why we are doing this right now, so that we improve the awareness
The
all
awareness,
around.
the awareness, exactly. So this is where I start to get emotional because the the double bypass surgery is hard.
Yes, I can.
It's
Yes, I can
hard.
imagine. Yes. So they basically, you have an incision in your chest. They cracked your breastbone, and they took a blood vessel on the left side of your breastbone for the front wall, and they took a vein for the right side circumflex.
They harvested from my leg.
Yeah. Yeah.
They harvested from my leg, and before I went in there, I'm like, "Look, doc, I got really good legs, so don't mess them up. And I'm young. Cut me low."
No.
Because
Yes.
I didn't want this scar way up
Absolutely.
here. And they did do that well. They so went in and for the double bypass surgery. This was again in Columbia, South Carolina. Um, the recovery is hard. The
Yes,
recovery's
absolutely.
so hard. And you know, um, what I didn't know until later, when my husband was allowed to come in and see me, he thought that they'd put something on my face. They had, because my skin was normal from my jawline down,
Mm-hmm.
but my face was gray.
Mm.
What it was they had done the betadine.
Yeah, yeah, yeah.
That's what made my skin look normal. It was
So pale about it. Wow. Okay.
so, we'd only been married for a year.
Oh, I'm so sorry. Yeah. Must have been truly heartbreaking. It is scary, and we don't understand how much of a ripple effect it has on people's life and emotions. I mean, it's been a while and it still cuts raw right now, doesn't it, Christine?
Oh yeah. hmm And and that's the thing that we also don't talk about with heart disease. We do it really well with cancer, and I am not diminishing this by any
Yeah.
means for breast cancer or any other kind of cancer. We have done so well of helping emotionally cancer patients, but with heart disease, we we don't talk about the emotional connection to it, and there's so much to it. I look healthy. I look, normal. You don't see my head shaved. Right now, you don't see my scar,
Yes.
but there is still a lot of emotions that you go through. Even when you're feeling good,
Yes.
there's survivor's guilt.
Mm-hmm.
How did
Oh,
I survive this? And somebody else didn't beat the Widowmaker. How did
yeah.
I beat the Widowmaker?
Yeah.
Um, there is you know emotions to it that are always there. When I hear about somebody's parent or somebody who has to have bypass surgery, I reach out to them, because things like, okay, you might rent a hospital bed so that they're more comfortable when they come home, because just
Yes.
you're more comfortable in the hospital because you can prop yourself up in
Yes.
just the right way. When you get home, you think, oh, I'll just do it with pillows. It's not the
Yeah.
same. And you get
Mm-hmm.
home and you hurt and you're
Yes.
miserable. And for
Mm.
women, we're also, because of
The
the weight of
breast
our
tissue.
breasts,
Yeah.
that also pulls on that incision and that sternum that's been
Oh,
cut open. The funny story was 3 generations of Gallagher men that went to Kohl's to get me a new bra, because nobody tells you you're going to be
yes.
puffy,
Yeah.
and not having a bra on, it makes the chest even more unstable. So my husband, his father, and my stepson all all went to Kohl's to get me an array of bras. My father-in-law comes back and said, I didn't know there were so many different colors. My stepson comes home and says, I was so embarrassed. My husband comes home and says, we bought 5. Let's try them on.
But that's such a valid point, right? This is a point which women would never discuss. I mean, I'm so glad you bring this up, that the breast tissue, it's truly an added challenge. And I've heard patients who are uncomfortable even to
Yes.
wear a bra, and they are uncomfortable when they don't wear a bra. It's like a lose-lose situation. They cannot tolerate the seat belt across their bra, because once you cut that tissue, the nerve endings are raw, and when they regenerate, you feel a different array of sensations: burning, numbness, tingling, etc. It can be quite traumatic at that point.
There's parts of my chest that are the feeling has never come back.
Yeah, yeah, yeah.
In so yeah, and like I said, getting home and the comfort of trying to rest is also very hard. So I sometimes I recommend, if you don't, a lot of times you can buy these beds now that
Yeah.
have adjustments, and I truly believe that we all need one, because you never know when something could happen, and
Happen.
you
Yeah.
you know you have to have some sort of surgery, and propping your legs up, or you're sitting
Yes.
up is helpful. But if you don't have that, renting a hospital bed. So I often recommend finding places to rent hospital beds. You may get home and say, I don't need it, but find the source before you get your loved one home.
Yes. I mean, that's a great point because when you are being discharged from the hospital, you have a lot more resources while you are in the hospital. You can have the case manager kind of say, hey, if I want to get a hospital bed, where would I get it? But when you come home, you lose that connection with the case manager. It might be very difficult to trace them back, or you might get discharged on a Friday, and then Saturday, Sunday, you have no
You're
contact with
miserable
them.
all weekend.
Yes.
Right.
So it's
So,
important to have all this beforehand.
and what does it matter if you get the hospital bed at home and you say, you know what, I'm good, I don't need it, then send it, then send it
Yes.
back. But you've got it to keep yourself comfortable so you can do that recovery.
Fantastic.
The other thing that's really scary after that is getting back. You need to do that walking and that exercise. And so, my husband was such a great advocate for me. And you don't want to go and walk around the house or walk around the block. And he'd be like, come on, let's go. We're
Yeah.
doing it. We're doing
Yes.
it. And that also becomes a confidence booster. You need that cardiac rehab.
Yes.
You need the cardiac rehab, not because it's some like super phenomenal, workout. No, it is giving you back the confidence that I can walk up the street that has a hill to it, and I'm going to be okay.
Such a
It's
fantastic point that is. It's
You
truly.
get so scared. I didn't know that our front lawn in Colombia had a hill to it until after that surgery. I never noticed that there was an uphill to it. I had some friends who, okay, they took me on a little bit of a walk, and I'm like, I don't know if I can get back. So we called my husband, and he picked us up on a golf cart. Um, but you need an advocate who makes you do what you're scared to do. And a
Yes.
simple walk is scary. So you need to do that right after the surgery, but then you also need that cardiac rehab to get your confidence up that I can go back to the gym, or I can start an exercise program, and I'm not going to have another heart attack, or I'm not going to have another event, because you do need to get that physical activity back in your life. And
You know,
that's a very scary time.
I'm so glad you brought up cardiac rehab. Most people don't know about cardiac rehab, don't know to ask for cardiac rehab, and think cardiac rehab is, oh, they're just going to make me walk. Cardiac rehab is just not about walking. It is one of the few interventions we have that actually saves life, like makes you live longer, okay, reduces readmission rates, improves depression after event like this, because open heart surgery is a life altering event, and a lot of patients have post traumatic stress disorder or anxiety, because who does heart disease mostly affect? Alpha people, like people who are go 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 go, like you, Christine. So when they have a heart attack and they realize that they are vulnerable to something as big as death, it really bogs them down and it takes away their confidence. Cardiac rehab, it's an exercise, monitored exercise program. And every week you meet with a nutritionist, an exercise physiologist, a psychologist, you have group therapy. They talk about what kinds of food you can have. And one of the biggest fears after a heart attack, whether you have a stent or a bypass surgery, is when can you go back to having normal relations with your spouse. And doctors, I agree, we don't do a great job of talking about it at the time of discharge. Instead, we leave it to our care team members to talk about it, and this is something which is talked in cardiac rehab. And when you can achieve your target heart rate or in the cardiac rehab without any issues, you know that you can kind of get back to exercising and get back to having normal relations with your spouse.
And here I was 39 years old and
Yeah.
in cardiac rehab. I like to say I was with there was these two older gentlemen, and they were like those old guys on the Muppets.
Uh-huh.
you
Oh
know,
God.
that sat up in the balcony and made the snide remarks, you know.
Uh-huh.
And so they're like, "What are you doing here?" And I looked at him. I go, "I'm here to get your heart rate up. You see how good looking my legs are."
True, true, true. Yeah.
So yeah, so here I was at 39 there with other people who were well above my age. But
Yes.
again, it was a confidence sort of thing. And going back to, is it harder on women than on men to have bypass surgery? They sat there and said, "Oh, it's easy. There's nothing to it." And when I came back to cardiac rehab afterwards, I'm like, "You guys lied to me." And they go, "No, it wasn't that hard." I'm like, "It was hell."
Yes.
I mean, I'm like, I don't know what you guys are talking about, but it was hell. And it still was the hardest thing I've ever done. So
All right.
anyway,
So let's move to the next phase. What happened? How did you feel? I mean, you can talk about how you and I met the first time.
so at that point, it was my husband, myself, and my stepson, but I still wanted to be a mom. And while I was super grateful to the cardiologist, obviously, who saved my life. He was an older gentleman, and when I went to him and said, "Okay, my ejection fraction is in the upper 50s. Look at my recovery. I want to have clearance. I want to be a mom." And he said, "You don't need to do that. That's just
Yeah.
not something you need to do." And so the thing about Columbia was that you couldn't get a cardiologist and a high risk OB in the same hospital there.
Mm-hmm.
And there was no high risk OBs in Columbia at the time. So you enter. um, I come to you and I say, "This is something I want to do," and you looked at me and said, "I got some tests we're going to run on you. We're going to see where you are and see where we can go from there." So I think you ran a
We did a cardiac MRI, cardiac stress MRI.
yes, you did the stress MRI. That was hard.
I know. But the thing is, I know, again, if I put you on a treadmill, you will pass it.
Right.
And we will be back in the same circle. We cannot completely trust the stress test on you, the exercise stress test. So I wanted to do a chemical stress test. And because women have breast tissue, the regular thallium stress test can give you a lot of confusion. So I wanted MRI. So therefore, it's a more higher level of imaging, and it gives us more clarity and it does a better job of separating shadows from breast tissue from actual real decreased blood flow to the heart. So it's more precise than the nuclear stress test, precise than the thallium stress test. So I wanted a stress cardiac MRI. And yes, it was a long test, I know, and it can be.
It was tough. And what was interesting was that I remember the technician said, "I can't tell you any of the results of this because that's out of my wheelhouse." But he said, "If I didn't know to look for damaged muscle, I wouldn't have found any."
Yeah.
He said, "I had to look hard," which, I mean, that's what's amazing is how far I came back in my recovery.
Yes.
So you saw the results and you gave me the green light.
Yes. So we saw signs of the old heart attack, but thankfully, it was a small amount of heart muscle, and you did not have any new areas of the heart which was not getting adequate blood flow. So, and it was a stress test. We put your body through the IV medication. We stressed you. So I was like, okay, we are going to watch you like a hawk. I want to see you every trimester. And we are going to be in close communication with your high-risk OBGYN as well.
And so I got a high risk OB here in Charleston. So living in Columbia, but all my care was transferred down here.
Mm-hmm.
So you and Dr. Eugene Chang were my team.
Yes.
And the comment that my husband made was, well, she has done pregnancy before. She's done childbirth before. She physically knows what it takes. And this is where I'm like, we need more female cardiologists too, because we
From your
need
mouth to God's ears, I hope.
we need more female cardiologists, because we need more female cardiologists that can completely relate to the woman that they're looking at and treating.
I agree. I mean, we are working on it. I am actively working on it, and every woman in the cardiology space is actively trying to recruit more women. And I think it is slowly but definitely changing. Because when you came first, I was actually trying for my third kid. I had two kids by then, and I was trying for my third kid. And your story hit me so hard in so many levels, and it made me so angry with all the people who did not catch you earlier. And I couldn't believe you had to have an open heart surgery at such a young age, and the good news is you were young, and so even though your heart had a big insult and your heart function reduced to 27%, but because you were healthy and you were exercising and you did not have other medical problems, your heart function jumped back to normal. It was able to compensate for that insult. So that was the good side. And I was like, we can walk you through this. We can definitely make sure you have a safe pregnancy, and make sure it's successful, and we can keep a close eye on you. That was my thought process.
Well, I tell people, you're the reason why I'm a mom. So I had a completely healthy pregnancy. We did do a C-section.
Yes.
And I have a 10-year-old boy.
Yes, we were pregnant together. I mean,
We were.
I have to go and find the pictures. You and I took pictures in the clinic with both our
Yes.
pregnant bellies together, right?
Yes.
It was very heartwarming to see you pregnant. It was truly amazing.
Well, I credit you with
Oh, no.
the ability
We were a
to.
team. We had a team of doctors working round the clock. Dr. Chang and I were in communication throughout. Each time I did an echo, and I would send him the results, and he was like, I'm planning a C-section. What do you think about it? I said, do not even go near normal labor. I will not stress our heart that much. Let's have a control. I mean, we were talking everything through. It was a team effort. So
Now he did cut me off then. So
yes,
so
you're done with your high risk pregnancy.
so because they did the C-section, and I didn't know in a C-section they like strap you down, and it freaked me out. And
Oh.
so after the delivery, they're like, do you want some happy drugs? I'm like, yeah. And so apparently when I was completely out of it, I said, my chest hurts, which I have no recollection of.
Okay.
And it scared
Yes.
Dr. Chang. And so when he came in the next day, and I've got Will in my arms, and he goes, you got one good one. Now you're done. He goes, you're
Yes.
done. Whereas you were like, okay, if you want another one, you got to get pregnant fast. And
Yes.
I'm like, I've been cut off.
No, because I think I remember this very well because I was in communication when you had your C-section. Our inpatient cardiology consult service was called, and they came and did an emergent echo on you. They were very scared. They were very, very scared. And he's right. I mean, by then you were 41. Am I correct?
Yeah.
35 is considered
I might have
geriatric
been 22.
pregnancy. Yeah, because Will is 52. I mean, you're 52 and he's 10 years
Yeah,
old.
I
Yeah.
was 42 when I had Will.
Yeah. So 35 years is considered geriatric pregnancy age. So 42 is like you're an octogenarian. You're an 80-year-old getting pregnant in their.
What was interesting though was you sent me to a fertility specialist in Colombia, and I had no idea what my fertility was. I suspected that it might not be great. She you know ran a test, and she goes, you see this over here? She said, this is an ovary of a teenager. She goes, I don't get this. I don't
You were
get this
just
in my clinic.
worried,
I don't get to see this in my clinic. So while my heart health wasn't the best, I had the ovary of a teenager.
we just had to move really fast on you, like, with the biological clock and everything. And,
Uh-huh.
and we wanted to make sure you had, you probably had one chance at this, and everything needs to be, Will is a miracle. I mean, he is a miracle baby. Like,
He is. And he's going to do something in this world. I'll tell you what.
Yes.
um, and if I'm going to get one, I got a really good one. I got a really good one. He's a sweet boy, and he's a lot of fun, and lots of questions every day, every
Good,
day.
good.
Ah, yeah.
Yes, yes.
So, and started walking at 9 months and and it hasn't stopped talking, never stopped talking. So, we call him the articulator.
But all I can tell you is it's amazing, and I'm so happy and thankful and honored to be part of your journey, because your story needs to be told over and over and over again till this story never happens to any other woman ever. That's the
Well,
goal here.
and where we need to tell it are the med students.
Mm-hmm. Yes.
The med students need to hear it, so that this is something that they keep in mind as they're moving forward in whatever specialty they go to, because again, it's getting out this message that the number one killer of women is heart disease.
Heart disease. Yeah.
And I say any specialty because the thing that I wanted to bring back up was, it was my OB that had all my blood tests. And the question I've had over the years is, this separation of your different specialties. We always ask, who's your OB or who's your GP? But when are we asking women, who's your cardiologist?
Yes.
And why, when the OB has those test results, why isn't there more of a connection in our health system to connect you guys so that so that a cardiologist sees it? Because while my cholesterol wasn't abnormal high, it was high normal for my LDL, but my HDL was low.
Okay. The funny part is I keep preaching in this podcast every time that every person above the age of 35 and on needs a primary care provider. Okay, even whether you're male or female, your OBGYN will take care of your reproductive health, but you need a primary care physician or a primary care provider who kind of looks at you head to toe, collates all the data like what you said, and makes the referrals as need be. Okay, for you, the referrals were made, but still the diagnosis was missed because you were tricky. It was hard because you didn't have any other risk factors. You're not a diabetic. You didn't, you're not a smoker. So it was so low on their priority list, and they missed it, unfortunately. And thankfully, you're still sitting here and talking to us, and you've lived another day to tell us the story, and that's what we can be thankful about. And the thing is, we all, like, when you couldn't find why you were having this chest pains, your healthcare system said, we have done all the tests, see you later, bye-bye. And you accepted it too. I said, I'm okay, I've done everything, I'm walking away from it now. But in a real ideal world, we should have gone further to see, why was it happening? Why is this 35-year-old female who swims, does triathlete swimming drills kind of a thing, who lifts heavy, is having chest pain? Is there something we are missing? And I'm hopeful with the current generation of tests which we have, the cardiac CTAs, lipoprotein little a measurements, and things like that, that we are more open to catching disease before a life-threatening heart attack happens to you.
Yes, I mean it's a lesson. It's a lesson on for patients, and it's a lesson for doctors.
Yes, so. Absolutely. So with that, your story, I'm so happy it has a phenomenal, beautiful ending with Will in your arms and Mike by your side, and it's a pleasure when I come to the Cub Scouts to watch the three of you in action along with my daughter. It's beautiful, and
Looking
thank you so
ridiculous in that
much.
scout uniform. I look I look like a truck driver.
You look amazing.
It
You
is
look
not
amazing.
flattering. It's not flattering.
But Christine, thank you so much for sharing the story and being vulnerable with us. And I truly appreciate it. And I hope my audience appreciates it as well.
Thank you. Thank you for all you've done for me, and your friendship means so much to me.
Thank you, Christine. Talk to you later. Well, folks, I hope you've learned a lot about heart disease, especially in women, and how it can be ignored and taken as something else, labeled as anxiety, all of the above. But the bottom line is we need to find the answer. And we as a medical community are working towards making ourselves more aware of this. And I hope Christine's story serves as not as a fear factor, but as a cautionary tale in all of your minds that heart disease is the most common, is the number one killer in women. And we have to be aware to prevent more of this happening. With that, I will see you all with my next episode. Thank you very much. Thank you so much for listening. If you found us valuable, you can subscribe to the show on Apple Podcasts, Spotify, or any of your favorite podcast app. And also, please consider leaving us a rating or a review, as that helps others find the podcast too. I hope you have a great week ahead.